Hi, my name is Sarah Van Putt. I'm a first-year audiology student at WVU, and I'll be performing your cranial nerve assessment today. Is it okay if I touch you?
Yes.
And what can I call you?
Brenda.
Brenda. I'm just going to put some hand sanitizer on and put some gloves on, and then I will let you know what we're doing next. The first cranial nerves I'm going to test is 3, 4, and 6. So all I'm going to need you to do is keep your head still and follow your eyes with my fingers. Okay. Next thing I'm going to do is check for pupil dilation. I'm just going to shine this light in your eye. Just need you to keep your eyes looking at my finger. Pupils dilated. And pupils dilated. The next cranial nerve I'm going to check is cranial nerve 5. I just need you to clench your jaw for me. And I'm just going to check right here and I'll put your temple. All right. And then the next thing I just need you to do is open and close your mouth. And one more time. All right. And this time we're going to do it with a little bit of resistance. I'm going to have you open up your mouth and do not let me push it back close. All right. And then we're going to do the opposite. Don't let me push your jaw open. And I'm just going to do the other one more time. If you could open up your mouth. All right. The next thing we are going to do is I'm going to present you with this tongue depressor. I'm just going to split it in half, and it's going to represent a sharp and a dull sensation with this. So I just need kind of use your hand for a second, and can you tell me what this feels like?
Sharp.
And then can you tell me what this feels like?
Dull.
All right, I'm just going to put these on your face in the 1, 2, and 3 sections of your face. I just need you to close your eyes and tell me what you feel.
Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
All right, thank you. For the sharp and the dull sensation, did you feel it to be the same on both sides of your face?
Yes.
The next nerve I'm going to test is cranial nerve 7. I am just going to look at your face really quick, make sure that there is facial symmetry. All right. And the next thing I'm going to do is ask you to move your eyebrows up and down. And one more time. And then we're going to do the same thing that we did before. I'm just going to add a little bit of resistance. So I'm going to have you keep your eyebrows up and don't let me push them down. And then I'm going to have you keep your eyebrows down and don't let me pull them up. And we do the same again. Keep your eyebrows up. And don't let me push them down. And then put your eyebrows down and don't let me pull them up. All right. And this next one, I just need you to smile and pucker. And for this next part, I just need you to keep your lips as tight as you can together and do not let me separate them. All right. For this next part, I'm going to use a different tongue depressor. And I am just going to put this in between your teeth and your cheek. And I just need you to not let me push it away from the midline. And this side one more time. And this side one more time. Okay. Next thing I'm going to do is I'm going to look in your mouth with this flashlight. I'm going to use this tongue depressor. All right, and I just need you to go And one more time. And then the next thing you do is just say All right, and one more time. All right. And then can I just have you cough really quick? Yeah, a little bit louder. One more time. All right. The next thing I'm going to do is I'm going to test your gag reflex. I'm just going to stick this to the back of your throat, and then you should have a gag reflex. Good. The next thing I need to have you do is, can you blow your cheeks up with air and try not to lose any of that air? All right. The next thing I'm going to do is I'm going to try and make you lose that air. Don't let me allow you to lose that air. Okay. Next thing I'm gonna test is cranial nerve 11. This one I just need you to shrug your shoulders and drop them. And one more time. All right, this next thing I'm gonna do, I'm gonna have you raise them and don't let me push them down. All right, the next thing I'm gonna do is you're gonna try and push up against my, there you go. Okay. All right, this next thing I'm gonna have you do is look to the left and look to the right. All right, and now I'm gonna have you look to your left, and I am going to try and push your head back to midline. Don't let me push it back. All right, and same for the other side. All right, and then the next thing I'm gonna do is have you look again, and I'm just gonna check your sternocleidomastoid and check the bulk of it, and it's bulk, and I'm gonna do the other side too. Nice and bulk. The next cranial nerve I'm going to test is cranial nerve 12. Can you just stick your tongue out and go left to right? And then up and down. And I have not noticed any tongue fasciculations or any deviations from the midline. I'm going to ask you to stick your tongue in your cheek and do not let me push your tongue back in. All right, and then the other side. All right, and that is all for our cranial nerve assessment today. Do you have any questions for me?
No, I don't.
All right.
Thank you.